Today, we're diving into a bold new movement reshaping rural healthcare with one of its frontrunners, Dr. Lee Matthis. If you're a chiropractor wondering what the future looks like, or a business leader looking to keep your team healthy and productive, this conversation is going to hit like the first adjustment after a 12-hour road trip. Let's roll. Hey everyone, welcome back to Beyond Adjustments. I'm your host, Amin Saeed, and today I have the honor of speaking with a returning guest and someone I consider a thought leader in the profession, Dr. Lee Matthis. Dr. Matthis is part of the leadership at Tuck Clinic, a healthcare institution that's innovating how chiropractic care is delivered across Southwest Virginia. From their WorkWell initiative, which we'll get into, to mentoring the next generation of chiropractors, Dr. Lee is someone who doesn't just talk about change, he builds it. Dr. Lee, welcome to Beyond Adjustments. Again.
Thank you, Amin. This is round 3, I think, for me. This is fun. Thanks for having me back.
Absolutely. Yeah, we did. We had you on the panel discussion, which was so much fun. I do plan on doing another one. Would love to have you back.
Absolutely.
I'm gonna make that one a little bit more interesting though, Dr. Lee. I'm gonna talk about topics that chiropractors bump heads about, because I think that's a healthy conversation to have. We'll make it fun, right? Of course. But I think it'll also promote healthy conversation and communication as well.
I think healthy communication is missing in the world, so I look forward to being a part of that.
Awesome. Oh, sweet. All right, cool. So you guys heard it. He agreed. He'll be on. So, all right. So let's jump in. I want to talk a little bit about the evolution of chiropractic kind of philosophy, we'll call it, right? Because you've been in the field for over 2 decades, which is unbelievable. How has your personal philosophy of chiropractic evolved during that time?
That's a wonderful, wonderful question. When I left Palmer College, there was something we called the Brady Hill bubble, where everybody, and the surrounding real tight-knit community at Palmer knew about chiropractic. They knew about chiropractic philosophy. And then when the bubble burst and you leave and go out into the real world, you take that with you. But just like leaving any institution, when you get to the real world and rubber hits the road, it has to mold and evolve to allow you to kind of fit into your new surroundings. So I always have my evolution of chiropractic philosophy in the back of my head. And the majority of that is I know what chiropractic can do and the potential, that we can have with an adjustment, and bridging the gap between my understanding of what's possible and a patient wants and desires is kind of where the evolution has occurred. How can I do the best I can for the patient in front of me based on their terms? So I've had to eat a lot of humble pie at times, when I had all the answers, but they weren't asking the questions.
Yeah.
So that's one of the biggest changes for me.
Love that. So a lot of chiropractors, I take that back. I'm not going to say a lot. Some chiropractors do chase trends, right? Like it's TikTok, right? I'm seeing a lot of these kind of trendy pop type, videos, which not for nothing, they're kind of fun to watch, because I find myself scrolling and watching like, oh, like that was a good adjustment, but it has nothing to do with the sound, right? Like all that. But anyway, so some of these chiropractors are really like chasing the trends. Like, again, like it's a social media TikTok thing. But honestly, at least from our conversations and from what I've learned about you, about Tuck, you've really managed to adapt, but while keeping grounded, which I think some of the chiropractors out there are losing, unfortunately. Yeah.
I've seen a little of that myself. So.
Yeah. But I do love that. I won't say it's a widespread, issue. I'm just saying, I have seen that where they lose the core value in a sense, you know.
I can agree with that.
Yeah. Anyway, but what has stayed consistent for you since day one?
Um, the desire to help the person in front of me.
Mm,
That's some of my backstory. Brought me into healthcare kind of through a little rough patch when I lost my grandmother and a routine surgery. But I still want to help people. So, the chiropractic world allowed me to do that in a holistic and, conservative fashion. So that stayed pretty consistent with me all the way through, is doing everything I can to help the patient that's in front of me, whether it's with an adjustment or a referral or a hug
mm,
or words of encouragement.
mm.
Just trying to be a positive impact on each person I encounter.
Love that. And then for listeners that are, brand spanking new to chiropractic, um, how would you explain chiropractic care to someone really who just still sees it as just kind of back cracking?
Sure. There is often some cracking of things, but the cavitation of joints is a natural phenomenon. I mean, it happens um, completely apart from an adjustment. You can turn around to back out of your driveway and something can click or pop somewhere. So the chiropractic adjustment is a more intention focused um, approach to find where interference in the nervous system could be, and removing that interference. And there are various ways of doing that, techniques and other things. But yeah, a lot of folks that come to get a manual adjustment. There's a loud pop, and it's very satisfying. Some folks don't necessarily need that, and we can a very good have a very good impact on them and help their situation without the fireworks, as it were, through
Yeah.
other techniques. And
Yeah.
so, yeah,
How do you tie that to the nervous system? So if you were explaining it to me as just
sure,
a new patient walking in again with that mindset, okay, you've explained the whole cracking piece, but how do you tie that to the nervous system?
sure. So oftentimes, if something is not functioning properly, let's say a joint is not moving as well as it should be, in the area that joint's not moving well, you're going to have quite a bit of changes occur.
Mm,
You can have neurological changes if there is interference with the nerve flow from the brain to a tissue. You can have myofascial changes where things tense up or they get real loose. Um, you can have histaminic changes where you have swelling, all sorts of stuff that goes on. So um, the body is controlled by the nervous system. Every tissue and organ in the body's run through um, communication from the brain to that tissue. So if the communication channels are clear, optimal function can occur. If there is interference in that through a subluxation or
mm,
swelling or chemical interferences, then removing that will allow proper function. And that's kind of the whole philosophy of chiropractic is based on, is the removal of those interferences for greater expression of life.
mm. I like to say if your mechanic explained your engine like most people explain the nervous system, you'd never drive again. But uh,
Good way to
anyway.
put it. Yeah.
And so here's a challenge question for you, Dr. Lee.
Sure.
In a world that's becoming more evidence based, um, and in some areas insurance driven, how do you preserve the art of chiropractic while navigating kind of the business of healthcare?
Sure. I think upfront communications and expectations is a big way to help navigate that from the very beginning. If a
Mm,
patient comes in and they do have insurance that they won't file with, my clinical approach is not going to change. The administrative aspect of how we work and interact with that patient often
mhm,
changes, just based on the hoops that I, as a provider and contracted provider with insurance, have to jump through, be it
mhm,
changing my ICD-10 codes, my CPT codes, what have you. The clinical aspect of what I do from patient to patient is very similar. I find out what's wrong. I come up with a working diagnosis and I work on that patient to help them progress toward functional goals. Insurances or third parties that come in and have
Hmm.
different requirements of me might change
Right.
how I approach something through the computer or my electronic health records,
Yeah.
updating outcome assessments and things of that nature. But I try to, as much as possible, when I work with my younger doctors and associates, quite often separating clinical and administrative aspects. The patient is the patient. Who's paying
Yeah.
for the care might vary, but you still need a very, very strong communication from the doctor to the patient so that they understand my expectations of them, help set realistic expectations for them of me. And those are some things that are pretty imperative. I think if you get that right at the beginning, that way nothing can come in from right field and ruin a relationship that you have with a patient.
Yeah. I guess not so much of a challenge question for you then, huh?
Well, I do have to do that day in and day out. And,
Okay.
one of the things that we do, I'm a very visual learner. So right around the corner here, I actually have a poster that was made up, that shows and helps me very quickly and easily explain episodic versus elective care. So what is insurance willing to cover and what is not covered by insurance? And,
Hmm.
and that visual has really helped a lot of patients understand that, oh, I've kind of plateaued, from a functional standpoint. I still feel great. I'm still healing. I'm still getting better with chiropractic care. Unfortunately, my insurance ain't going to cover it because, you know, we can't jump through those hoops.
Hmm. Yeah.
Excuse
Oh, you're good. Bless you.
me. Woo.
Bless you. Now I
Thank
got
you.
to think about, do I keep that in? Do I not? I don't
Absolutely.
know. We'll
Keep it
see.
in. I, I have an allergic reaction talking insurance because it can be frustrating.
That's awesome. All right. Well, I appreciate you being upfront, being open about that topic. It's a good I wouldn't say good, but it's a topic that I think some people dance around because they're afraid to really tell the truth about it. So, um, one of the conversations I had with my chiropractor back when I needed kind of a, um, just kind of I would call it not an intensive, but really a shortened care package. We'll call it, because I was just kind of going through something. We had that conversation. It's, hey, this is what it's going to cost you. Your insurance will probably not cover most of this part. Here's what you actually need. Like this is where you're going to see the results, right? Like this is, um, and we had that conversation, and I ended up just paying for all of it, and of course benefited from it, um because I do trust my chiropractor. But that's another story. You need to trust your chiropractor. But anyway, but yeah, it's a hard conversation to have. It's a
It
hard
is.
conversation to have.
The what I've seen a lot more is you mentioned it right there. Trust your chiropractor, and the
Yeah.
huge majority of chiropractic patients trust their chiropractor. The chiropractor has pretty intimate knowledge if they are participants in insurance companies. They have a pretty intimate knowledge of how
Yeah.
insurance works. The
Yeah.
the patients typically do not. Prior to learning it through, having to do it every day, I really didn't
Hmm.
understand my insurance.
Right.
And patients do not, since it's
Right.
mandated and patients have to have insurance. They don't understand. They just read their benefits page and it says, "Oh, I've got chiropractic benefits."
Right. Right.
There's also a provider page that says, "Hey, in order to be reimbursed for those
Yeah.
benefits, these are the things that you need to,
Yeah.
make and necessitate reimbursement for care." So it is a pretty open conversation, and that again, if you have at the beginning, just like your chiropractor did, it's a lot easier to navigate, as opposed to have somebody be upset.
Yeah. Who, by the way, who my chiropractor is. He was on the panel discussion, Dr. Juan.
Yeah,
He's
yeah,
my
yeah.
yeah, he's my
Very
chiropractor.
nice. Good deal.
Yeah, yeah, great guy. Cool. All right. Before we jump into the next section, I wanted to bring something to light that I think is very important for this show, and it's that both Dr. Lee and I are bald today.
I'm glad you pointed
We
that out. I think you're going
we're
to miss
we're
that.
we're matching. Yeah, just in case you weren't looking at the screen. We
That's right.
weren't that way the last time we chatted, but now we match. We both got beards going for us
There
and
you
bald
go.
heads, so makes it a little bit more interesting to watch. But anyway, moving on. No, I love it. So I want to talk a little about kind of Tuck Clinic's model, the WorkWell. We kind of touched, we hinted at that earlier. I want to speak about that WorkWell initiative, but so Tuck Clinic really has a reputation for collaborative care. That's one of the things we touched on a couple of times when you and I spoke.
Yes, sir.
And I believe innovation is in there as well. But how did WorkWell or the WorkWell program come about, and what makes it so impactful?
I'm grinning ear to ear. That was our previous question is a beautiful segue into this. Um, and it all centers around the frustrations of third party insurances is where WorkWell
Wow.
came from.
Okay.
My previous boss and dear friend and mentor, we actually lost him about a year and a half ago to a very aggressive cancer.
Oh
Um,
no.
he and one of his dear friends 5 or 6 years ago, Ray ran a healthcare company. He ran Tuck Chiropractic Clinic, and he noticed that year after year, um, our patients' premiums were going up, their deductibles were going up. We, as providers, were having to provide more and more and more documentation and information to get paltry reimbursement. The reimbursements were going down while the workload was going up. One of Ray's dear friends, gentleman was a CEO of a local trucking company who was um, medium-sized company, and they were having their own frustrations. They were self-insured.
Mm,
So they saw the same thing. Their premiums were going higher and higher.
interesting.
Their employees out of pocket deductibles were going higher and higher. The quality of care that they were receiving out in the fee for service world was less than what they thought they were paying for. So the quality
Mm,
of care was not quite as good as the premium that they were paying. So Ray and his friend decided that, hey, we both have these complaints about healthcare. Let's get together and see, just throw some ideas against the wall and see what sticks. So they literally locked themselves in a hotel suite for 3 or 4 days and came up with a way to circumnavigate the main frustrations that both providers and employers were having, and WorkWell was born
mm,
out of that. So
okay.
basically what WorkWell is a way for us to help medium-sized, small and medium-sized self-insured companies mitigate their healthcare costs while at the same time building trust in their employees' providers and maintaining a very high quality of care that is what the patient needs, not just hoops to jump through fee for service wise that they had to pay for every service that was provided. And they were our pilot company. It was a medium-sized trucking company. And of course, truckers are seated for long, long periods. It can be a high stress job. The diets on the road were not the greatest. So
Hmm.
then in comes the chiropractic philosophy of just good old common sense living, and WorkWell was born. Um,
Love it.
we started with DOT physicals,
Hmm.
having a provider on site that was capable of providing DOT physicals for the driver kept them from having to leave the road, which is where both the company and the employee made their money. They could have it on site, which kept them from having to go hunt down somebody that would provide a DOT physical for them. It was quite a bit quicker for them to get those DOT physicals, as opposed to another third party provider doing that.
Hmm. Right.
Um, Pre-employment screenings, drug testing. There were several things that this entity needed, and we were able to, collaborate with other providers in the allopathic world to provide those services. We also provided chiropractic care.
Hmm.
And that was a big
There
bolster
it
to
is.
them wanting
Yeah.
to do it. A trucker
Yeah.
gets off the road and it's like, oh gosh, I'm been sitting for 5 straight days. Yeah.
Yeah.
got their adjustments, and they felt a
Yeah.
lot better.
Love that. Love that. So pretty much here partnering with local businesses, really, and it's mainly in the Southwest
So
Virginia area right now.
it is basically a model of occupational health. And occupational health is well known. It's it's been around for a long, long time.
Sure.
And providers will go on site to larger companies and provide health
Mm,
care to help offset the cost for the company and to have health care available for the employees. Um,
mm,
the way we did it, very similarly set up, but we did have the wellness aspect and the chiropractic component that was a big, it was a big sell point for the companies that we've worked with over
mm,
the last 5 or 6 years.
mm. Are you at all involved in the program yourself?
In what fashion?
Not in the kind of oversight, but actually going to these small businesses and providing the care at all.
No, we actually, several of our other chiropractic associates do that. And we also have independent nurse practitioners that are, blood
Mm,
draws. And in my state, my scope does not allow me to,
yeah.
draw blood. So we have,
Yep.
we have other providers who that fits their scope of practice. We have collaborated with, a medical doctor in an area where one of our clinics is, who's been a very big advocate of chiropractic care throughout the years.
Mm,
And he does any necessary medical oversight. His license allows him to do that, so we collaborated with him, and he oversees the medical aspect of things.
how are you bridging or building bridges between the employers, chiropractors, and really the broader healthcare community?
It's one of those things that when you've done it, the employers are your biggest raving fans, second
Hmm.
only to their employees, and that word gets out. All of a sudden you've got an employee who can have their basic healthcare needs taken care of by somebody else. And if they need something that's a little beyond, what we offer, they go to their medical doctor and say, yeah, I've been working with this group, and the word starts to pass around like that. As you well know, in the marketing world, the best marketing you can do is to take great care of the patient in front of you. And
Hmm.
so as we've continued to do that and bridge it out beyond our clinic system into, a larger employee based company setting, that word has really gotten around, kind of taken off like
Yeah.
wildfire. So
Yeah. What kind of feedback are you getting from the companies or even employees who go through the work well program? Excuse me.
really, really, really good. The employees themselves, they love that as a benefit. So it is a big recruiting and retaining benefit that the companies are offering their employees. They realize that the quality of care, the availability of care is huge. If you were to try and call your primary and get a just a wellness physical, it could be up to 3 months. Not to mention if you need to get into a specialist, that could take quite a bit longer. Working through us, we can vet those employees/patients and say, hey, you might want to try this, and we'll
Mm,
try and get that set up for you. But we're going to work with you until that referral time shows up.
mm,
From an employee standpoint, one of the biggest feedbacks that we've gotten is the mitigation of healthcare costs. So when we
mm.
contract with these companies, we do it for a flat fee. It's like, hey, here's what it's going to cost you. The accounting department loves that, especially if they're having to stroke checks every time somebody
That's
runs down to the Med
yeah.
Express clinic for
Right.
a sniffle,
Yeah.
excuse me. That's money that they're spending. If they have that offered in house, and they know that the quality is going to be high, the wait times are going to be reduced, the time out of work is going to be reduced as well. The accounting department's become our third biggest raving fan. So
I'm sure. I'm sure. So, I always, like to say that chiropractors help people show up better in life,
that,
really.
that's
Um,
sure.
but you're helping them show up better at work too, and that's
Uh,
that's that's awesome. And I love kind of how it's changing the landscape of the healthcare world.
Sure.
Yeah, and I'm sure the accounting department loves
They do.
that
I
no
like,
surprises approach.
sure. And I like how you said that. We help people show up better in life, but if you expand out beyond that, we show up better when we know we're doing a good job for somebody. The
Yeah.
employers show up better because it's like, hey, we've got these benefits and we see you using
Hmm.
them, and isn't that cool? And then your employees show up better because they're well adjusted, and they're
Absolutely.
not as frustrated with this healthcare system that's, it's not most efficient.
Yeah.
Oftentimes
Yeah.
it's not as
Yeah.
effective as it could be. So
Yeah.
we become advocates in helping navigate the broken aspects of it, and hopefully
Yeah.
having a better product.
Yeah. Yeah. Absolutely. And kind of helping. I think it's also helping change or shift the mindset from a reactive to proactive and preventative, right? So
Absolutely.
what's your take on that actually? What's so that it's actually a good segue into this topic.
Sure.
What's what's your take on how chiropractic care can actually shift from being reactive to being proactive and preventative in healthcare?
Again, I'll go back to the bridges, building a
Hmm.
bridge to the patient or the employer that you're referring to, and they know what the issues they have. So how
Hmm.
can we work together to prevent those issues from becoming problematic? If you're working with a trucking company, poor diet, long sitting, probably a bad sleep schedule. Are there
Sure.
ways that I, as a chiropractor, as I, as a person, can help mitigate those extenuating circumstances? I'm probably not going to be able to keep you from driving 8 straight hours. However, if I know you're going out on a long haul, 8 hours later, I can have my EHR send a reminder. Remember, do your standing side glides, walk around your truck
Right.
for 20 minutes. Did
Nice.
you eat a salad this week while on the road? And again, it
Answer
seems
no.
super. Yeah. Well, sometimes they do. Sometimes they
Yeah.
do. The cool part about that too is, I mean, we've been able to, with the company's blessing, expand that to families. Not
Mm,
just the employee, but the employee's family. So when you bring the
nice.
family into that, Mr. Trucker's wife, Miss Trucker, has told him for years, you need to eat better. You
Yeah.
need to eat better. So if I, as the provider, the trusted provider, am telling him that, she's probably shooting him a text about that.
Yeah.
It registers at
Accountability.
some point. Yeah.
Yeah. Yeah.
And
Yeah.
y- most folks show up in our clinics in a place of crisis where they're hurting, they can't function real good. Part of our job as a doctor and teacher is to show them how they can keep that from happening through what
Mm,
we call good old common sense. Um, you know, Move your body, hydrate
yeah.
well, eat a good balanced diet, and then get adjusted.
Yeah. Motion is lotion too.
Yes, sir.
Yeah. So, okay, I want you to imagine, kind of put yourself in a seat at a national healthcare summit. Okay. What's one idea you would put forward to integrate chiropractic more deeply into the mainstream?
Well, well, that's a really good question. Um, I would probably lean on two things, and it's very. One is the cost. What we do from a cost perspective saves tons of money for individuals and for systems, be they employer systems or insurance systems.
Mm-hmm.
You can always, I would assume, you could always turn, the national political heads, as it were, if you could show them the cost. I don't know that we have the data. I don't know that we have the data. I think the data's out there. But if you could show the cost savings of common sense preventative approaches versus a very expensive, very technologically advanced, very, pharmaceutically driven reactive standpoint, I
Mm-hmm.
think that's
Mm-hmm.
one way that, we would build less expense in healthcare, higher quality of health for our communities and our
Yeah.
nation. And also at a really good savings to the entire system. Um,
Yeah.
a lot of folks who are making a lot of money on the way the system is don't like that. So you'll see
Mm,
huge lobby groups that spend billions of dollars a year, negating the again common sense approach to
sure.
what our profession has historically done.
Yeah. Yeah, but even with that pushback, I think like so like if a chiropractor had pitched preventative spinal care at a hospital board meeting like 20 years ago, they'd probably be laughed out of the room.
Sure.
But now I think, I mean, they might not get a standing ovation, but at least they'll have the conversation. I,
Sure.
I think at least I think we're getting there, in
Yeah.
my opinion.
And I think too, when you can, there is an evolution in the way that
Yeah.
reimbursements and programs or pathways through allopathic health. We do work a lot with local allopathic providers to educate them on, hey, this is what we do. This is here's our data. We'll show you our data. And if you have patients who are, caught up in the rigmarole of the payment of healthcare or the wait, so to speak, how can we help them in the interim? And a lot of
Yeah.
times, we get referrals from orthopedic groups for patients who show up there that don't want injections, that don't want surgery,
Hmm.
they're not willing to
Hmm.
take pain medications. And so the
Hmm.
ortho or pain management doctors, they're at a loss. That's
Your
their
hands are
hammer.
tied at that
Yeah,
point.
that's
Yeah.
what they do. So if the patient doesn't want that, and through shared decision making, they can say, hey, if you don't want what I've got, or if it's going to be too long, why don't you give these other options a try? And I
Hmm.
do think chiropractic is finally getting good footing on those lists of referral sources in the allopathic world.
That's good. I love hearing that. I love hearing that because I think we're also getting to a point where the newer and newer generations are asking more and more questions.
Yeah.
Um, and asking the why. And I think that's important. Like, why? Why do I need to take this medication? Why do I need
Sure.
to have this injection? Or is there any other option? Right? We're full of, we're in a world where there's options for everything, different colors for every single product,
Absolutely.
different flavors of every single food that you eat, and why can't we have that same mentality when it comes to healthcare? Right? Like, like
I
why
like it.
why do I need to take this antibiotic when I just have a sore throat. Like, can I
Sure.
just eat some honey or something? Like,
Yeah,
and I think people are asking those questions,
they are.
and I think it's important, and I think it's actually helping shape the future of healthcare. That's my hope, maybe.
Sure.
I am seeing that maybe because I'm close to it. I'm always having these conversations, but I try to also take a step back and seeing, okay, what's the world actually saying, and
Sure.
what are we actually seeing? So I'm hoping that that shift is real and that we're seeing that. So that's honestly my hope.
I will say one of the good things about these, computer bricks that everybody carries around in their pocket all the time is they now have that access at their hands. They want to know what their options are. And if the provider they're in front of doesn't have more than their way, then they can, jump on Insta tweet or FaceSpace or whatever, social media. They can listen to amazing podcasts like this and get it from the horse's mouths. There are options that they're willing to listen to third party validation through social medias and things of that nature, which is again, it can cut both ways, but it
Yeah.
does have a really good way of pushing the conversation.
Yeah. Just FYI, I'm probably going to use that in the title of this episode.
Go ahead.
I
My
love it.
my my
Yes.
my wife says, "Why do you say that?" I'm like, "I just
Insta
mash them all
tweet and
together." That's
face space
it's the
or
tweets and the
my,
face space.
yeah, yeah. I'm from the MySpace era. That's when
Yeah, that's what I was
yeah,
too. I had one of those in college.
yeah, yeah, yeah. So, okay, so let's shift the conversation a little bit, because you also, first of all, awesome, awesome, awesome conversation. I love the WorkWell initiative.
Sure.
I'm gonna watch it closely. Honestly, I want to see how it expands and honestly
Absolutely.
how WorkWell leaks into not just using or reaching out to the family members for accountability, but maybe that actually starts to impact the family as a whole to say, hey,
Absolutely.
my husband or my wife is getting chiropractic care through their company and this is the results they're seeing, maybe I should give it a try too. I mean, at least that's the hope.
Sure.
So I love that. I love that, and I really appreciate what Tuck Clinic's doing in the healthcare space, really.
Sure.
But what I'd like to shift the conversation to is the
Sure.
mentorship piece of it, because you guys do feed into and you do raise younger chiropractors, and you have the preceptorships internships and what have you at your facilities. But that's one of the things that I mean, there's a couple of spots where, at least that I'm close to, I'm seeing it, where the chiropractor is kind of pouring into the younger generation of chiropractors through internships and what have you, versus just bringing in an intern and having them bring them coffee and make copies and just seat patients where they need to go. They're actually having conversations.
Sure.
Just the other day, actually, so my son went through another scoliosis intensive. I think I mentioned that to you earlier. Terrible. I hated it. He hated it even more because he was in excruciating pain. But it was an answer to his problem. It was a solution, and actually, he saw great results. But while we were there, we saw different interns show up at the facility, and it wasn't hey, just put this person here, but they were actually having conversation. Well, do you know why I just did this? Do you know why they're using this machine? Do you? And they would ask them, and they would actually challenge them. They would wait for an answer, and then if they were right, great. If not, they would help them and correct them. So that to me is important when it comes to mentorship versus just bringing somebody in and just having them do the grunt work. And that's because I don't think that's going to give them anything. And there's no value to that. Right.
Agreed.
So forgive the rant, but you've been a mentor for many younger chiropractors over the years, I'm sure, right? So what do you believe is the most important mindset or habit you need to develop like right now?
Oh, wow. There's something called the Dunning-Kruger effect. I don't know if you're familiar with that, but
I am not, but
the
I'm gonna write it
Dunning-Kruger,
down.
yeah, write that down. The Dunning-Kruger effect is basically when you finish a certificate or a doctorate or a program, when you're fresh and new, and you're on fire for something, you think you got all the answers. Your ego takes over and it's like, yeah, I became a
Mm,
chiropractor. I got
I'm
all
gonna do
the
that.
answers. I
Yeah.
passed my national boards. And then on day one, when a patient has to be literally carried into the clinic and they're screaming in pain and they can't feel their leg and their wife's worried and all the other patients are looking around, you
Mm,
realize very quickly that you don't know what you don't know. And so you go from this heightened genius to this bottom feeder of oh my gosh, I don't have it.
yeah.
And it is a long, slow slog to get up to the point where you're comfortable and competent at navigating situations like that. So
Mm,
I was very guilty of that. I had all the
sure.
answers when I
Oh, yeah.
graduated. You know,
Yeah.
some of my mentors will tell you, like, yeah, Matthis was a genius. You should have just asked him. He had all the
All the
answers until
all
he
the
did.
answers and all the hair.
That's it. Yeah. I realized I did not have all the answers, and I have now lost all my hair. But you know, that having somebody hold my hand and walk me through and
Yeah,
help
for
me
sure.
navigate the subtleties, the soft skills, you know, chiropractic school, any higher level academic endeavor is very black and white. The academic textbook says do this. Well, in the real world, you have to navigate, are they capable of doing that? Are they financially
Mm,
able to do that? From a time standpoint, can they make it to the office as many times as you recommend they come in? You know, multiple factors that they get thrown in on top of that academic knowledge. And that can be very overwhelming,
mm,
especially, you know, to young doctors who have just come out making straight A's and they've got a doctorate and all of a sudden they don't know anything. So it can be a big
for
ego blow
sure.
as well. Um, One of the things that we've attempted to do, and I think done a decent job at it, is building out a process and a protocol that allows us to honor the fact that we are working with a peer. You know, they have a doctorate like I do, but at the same time, mentoring, because I've been around for a while,
Yeah.
and being open to ask or to answer questions that are asked, to ask
Mhm.
questions of the younger doctors to make sure that they have a good understanding, in a real world capacity of what they know.
Yeah.
You know, and that to me is what mentorship is. And I had some great
Yeah.
mentors. I still have some really good mentors, and I want to be able.
Awesome.
You mentioned earlier legacy. I want to be able to pass that on
Yeah.
to future chiropractic generations.
Yeah. Speaking of, right? So as you look ahead, what legacy are you hoping to really leave through your work at Tuck and the profession at large, really?
Sure. I do not mind being a stepping stone to somebody learning as much as they can, from my bank of
Mm,
knowledge, and then moving on and taking what little I might have imparted on their wisdom, and sending them to the next level. I think that's very important. When it becomes time if you've gotten all you can out of something, it might be time to move on. And if somebody realizes that and taps into that personally, I support them. I had
mm,
an associate who worked with me almost 5 years, and phenomenal doctor. And he had a family opportunity that would carried him to Florida. And he told me through tears that, if you ever want to see how your clinic looks in Florida, come on down. I'll show you, because I'm going to do this because this works. This works very well, out there in the real world. So if you want to see a transplant, come on down and I'll show you. So
yeah, awesome, man, awesome. And I love what you said there. Honestly, you being willing to be that stepping stone, that shows humility, and it shows that you are in it for kind of the broader, um, wider reach of what healthcare should really look like.
sure.
And you're not in it to, you're not in it for the salary. You're not in it to, oh, one day I'm going to be this huge. No, you're actually taking the approach of, even if I need to be in the background
Absolutely.
and be used that way just to promote health, I would. And I love that. So thank you for that.
Thank you.
Yeah, absolutely. So what's one thing, Dr. Lee, that you wish you'd done differently earlier in your career that could have really accelerated your impact?
Wonderful question. I'm notorious for asking a lot of questions.
Okay.
And a lot of times the answer did not jive immediately with my consciousness, if you will. I wasn't evolved to that point. So I wish a lot of the answers to the questions I asked had not gone in one ear and out the other. I wish they'd have kind of stuck around. So taking down notes, journaling, jotting down little nuggets of wisdom, whether they were applicable today, tomorrow, whatever, and being able to look back through that. I think that would have served me in the long run. I would have probably learned things a lot faster. I have to do things wrong several times before I learn how to do it right. I'm willing to do that, but I do think from an efficiency standpoint, I could have had a lot less heartache had I just listened to what somebody told me.
Yeah.
Even if it was an "I told you so," I should have listened.
Yeah. 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 Those are hard to hear sometimes.
They are.
And anybody that's lived on this earth for more than 10 minutes would agree with the fact that hindsight is
It
2020,
is.
right? But when it comes to that legacy conversation and legacy vision, that's about like a 10,000 foot high
Sure.
view. But I think it's important to keep part of your conversations. It's important to keep part of your, really your daily why. Like, why am I even doing this? What am I looking to leave in the long run? Like, what kind of impact do I want to leave? Am I getting up in the morning so I can create 5 Instagram videos so I can get, 10,000 views, of me cracking and popping my patients? Or am I actually doing this to further healthcare? Am I doing this to, better our communities? That's the question that you need to ask yourself. And it comes and it's tied to legacy. It's tied to legacy because you want to understand, really, for your own self, for your own mind, why am I doing this and what am I leaving behind?
Exactly.
If I am not here tomorrow, what kind of impact am I leaving for the person that's taking over from there?
Exactly.
Whether it's somebody, that might be taking over your practice, or somebody just coming in to fill that void in that area that you don't
Sure.
even know. And I think it's important to kind of keep that in the back of your mind.
I agree.
Um, yeah. All right. So, what keeps you excited about the future of chiropractic, Dr. Lee?
Woo. Um,
Yeah.
we have a statement that our leadership team has used for years. There are mountains of opportunity. mountains of opportunity. Um, you can define that however you want to. And again, doing
Yeah.
the collaborative crossover with the WorkWell, there are my waiting room is often full, but I have an associate who again there's plenty of patients that need chiropractic care in the
Mm.
world, and I do think that the more chiropractors we have, and the more collaborative we are with each other, the more impact we can have on humanity. Which would go back to having the seat at that big national table of how is it going to help. Well, I think if every chiropractic office was overflowing, the world would be a better place, and
Yeah.
more folks would be brought into the profession. More folks would be open to the impact that we can have on
Sure.
humanity. So
Yeah.
that kind of keeps me jazzed.
Love it. Love it. Love it. Love it. Well, I was having a conversation the other day with actually my son's specialist, his chiropractic specialist, his I should say scoliosis specialist. We're talking about my area specifically, so Fort Mill, South
Yeah, yeah,
Carolina, and I I was telling him we were actually talking about just the different brick and mortars that were around for as far as chiropractic offices, and Fort Mill is saturated with chiropractors. There's one area that I can walk to three different chiropractors' offices within like minutes. One of them actually in one strip mall. Both are there. Like or one business park, I should say. Um, but the point I'm making is they're all still open.
sure.
They've been there for years. It's because either they're doing their marketing right and they're able to stick around, or they're actually helping people. I'm gonna say that it's probably the latter.
Sure.
So the reason I say that is, don't be afraid to look into an area that might have little too many chiropractors than you think
Sure.
it should have. But also look into the population, look into the needs of that population, that community. um, you can find that information in those stats in many different places. But if you look into that area and notice a gap, I would even like I would even challenge the 7 mile radius conversation that people like to have, which is it's a Google Map conversation, yeah, um, and it's important. So don't set it aside. The 7 mile radius conversation needs to be had from a marketing perspective, but that doesn't necessarily mean that you need to be the only chiropractor within that 7 mile radius, because it's just not going to happen. I would look at a mile or two and then look at the density of the population there. I promise you that you will make a huge impact in that area. But yeah, sorry, I'll get off of that. But I think it's important because it scares chiropractors away from opening up a facility, because they're like, oh, there's somebody 4 miles from this spot. You're fine.
Sure.
You're fine. 4 miles is a long ways.
It is, and folks want convenience. I mean, we do live in the 21st century, and everybody's used to having everything very quickly. We
Yeah.
have a chiropractic office right across the street. My office got busier when it opened. It's if we look at it from an
Attracts
abundance
people.
mindset as opposed to a
Yeah.
scarcity mindset, there are plenty of patients with needs that we can help um, with, help solve their problems. If we can't do it, make a referral to the chiropractor down the road, get to know them. They're going
Mhm.
to want an adjustment soon. So, be the doc that reciprocates adjustments with them.
For sure.
And we for years have been known for infighting. We eat our young, this, that, and the other. And I do think we're starting to branch out of that a little bit from a collaborative mindset.
Yeah.
As we can work with our brothers and sister chiropractors, um, more openly. If I have a patient that doesn't necessarily want to see a male doctor, my associate's female, and I'm very happy to refer them right across the hallway. But it doesn't keep me from referring them down the street prior to her being here. They
Hmm.
wanted a female chiropractor. Here's one that does a great job. You can go see her,
Hmm.
and I wish you the best. Um,
Yeah. Yeah, I think if we approach it from a collaborative mindset, I think it'd be we chiropractic care in general would make a much stronger impact, honestly, on the community versus you know keeping the silo and being afraid of the guy down the street or the gal down the street stealing my patients, because it doesn't need to be that way, honestly. But anyway, so question for you, and this is probably my last question for you,
Okay.
Dr. Lee, but how can people connect with you or learn more about Tuck Clinic,
Yeah.
WorkWell, all of it?
All of that. Tuckclinic.com. I've got a bio page on there. My email's there. Feel free to reach out, shoot me an email. If you're in Christiansburg, swing on by. I'm happy to chat with you. Yeah, I'm we've got all the social media stuff. I'm fairly easy to get in touch with. So yeah, feel free to check us out and reach out if you have any
Perfect.
questions about anything.
Perfect. Perfect. And I will swing by the next time I'm in your area,
Yeah,
just
come on by.
FYI.
Come on by.
Yeah, yeah, yeah. I'll come by for an adjustment.
That'll work.
But I need you to refer me to somebody else. I
Oh,
don't want you to
okay.
do the
I can do that.
All right. Well, I'm gonna leave you guys with this. Whether you're practicing in rural America or a major city, right? The challenge is the same. How do we serve better? How do we lead better? And how do we elevate the standard of care? That's the question I want to leave you with. But Dr. Lee, thank you so much for being on the show yet again. Always love having you, sir.
Thanks. I mean, it's been a pleasure.
The pleasure has been all mine. And I look forward to having you on again, especially since you've already agreed to the next
Yeah, I
panel
did. I
discussion.
agreed to
So
it.
that's on camera.
Very nice.
But yeah, that's a wrap. This has been another episode of Beyond Adjustments. A huge thanks to Dr. Lee Matthis for just sharing not just his wisdom, but his vision for how chiropractic can be a pillar in modern healthcare. If today's conversation got you thinking differently about your role in the system, then hit that follow button. Really share it with somebody that you think could benefit from it. And remember, you're not just adjusting patients, you're adjusting the future. Until next time, stay aligned, stay inspired. We'll see you in the next one.